Baby hiccup. Hiccup is a sudden involuntary contraction of the diaphragm that causes a sharp intake of breath and leads to partial closure of the vocal cords. This often results in a convulsive gasp. This is something that happens to anyone but is common in babies. They are a completely natural process in strengthening the vocal cords of your baby. Baby hiccups are sometimes referred to baby acid reflux. This acid reflux situation usually precedes hiccup because it is a situation whereby foods earlier eaten fit a way back to the esophagus of the baby, thereby leading to discomforts and then hiccup. Hiccups happen most times just after eating, as the baby's stomach has not yet adjusted properly. It is a normal occurrence, so young and new mothers shouldn't panic when their babies start hiccuping. Baby hiccups is not a new thing in the life of a baby. It is also normal for babies who are still in their mother's womb to experience hiccups, so don't be frightened when your baby begins to hiccup. A baby usually experiences hiccup during the first 6 months of their. However, it is mandatory to know the difference between hiccups and choking. This article would be dealing on the causes of hiccups, the remedies of hiccups, the various differences between hiccups and choking, and also things to do to stop hiccups when they do occur. Causes of baby hiccups. As much as hiccups are common in babies, there are also causes associated with hiccups. Hiccups occur when the muscle called diaphragm contracts. This contraction is needed to make the muscle strong. The causes of hiccups are strongly associated with feeding. This is because while feeding your baby, air gets into the stomach. When too much air is in the stomach, it results in hiccups. Some factors that have been associated with baby hiccups are also changes in the weather or climate. If there is a sudden drop in the temperature of the environment or even the temperature of your baby, there would be contraction of the muscles resulting in hiccups. The baby starts hiccuping from the womb most times in the second trimester. At this stage, a sensitive mother can always feel it when it happens. This is another major cause of hiccups in infants. Babies also hiccup when they cry or cough. This is especially common in babies in the first 3 months of their life, and it gradually ends when they get to 12 months and above. In very few cases, the hiccuping has led to visits to the hospital. Baby hiccups and their remedies. Though hiccups in infants are common, there are also remedies that you can use when they do occur. It is advised by qualified medical practitioners that when feeding your baby, you shouldn't rush, no matter how late you may seem to be. They also advise that you follow simple feeding directions. Also, hiccups don't have an adverse effect on the baby, as sometimes they seem to enjoy it, so parents are enjoined not to get worried when their babies have hiccups. You can also put a little sugar on the tip of your baby's tongue. This would help to redirect the nerves to the sweet taste on the tongue, thereby removing the baby's mind from what is happening in the diaphragm. The muscles would have less concentration on them. Differences between baby hiccups and choking. Hiccups in babies are usually not as uncomfortable as they seem. This is because the muscles are simply exercising themselves. Choking is categorized majorly by intense crying and serious gasping for breath. When this occurs, it is advisable that your baby be taken to the nearest clinic because delay could prove fatal. How to stop baby hiccups when they do occur. Hiccups are common in anyone. So, firstly, don't panic when it happens to your baby, as it would definitely disappear just the way it came. Check the hole on the nipple of your baby's bottle to ensure that it is not too wide, because excessive air would increase the risk of hiccups. So caution must be applied. You can also stop hiccup in your baby by patting your baby's back. Also, when feeding, ensures that your baby and all your baby equipments are in comfortable positions. Also, ensure that when your baby is through with feeding, you immediately wind your baby by rubbing on. Also, ensure that when your baby is through with feeding, you immediately wind your baby by rubbing on our baby's back. This is done so that excess air and gas that has been lodged in the tummy during feeding can go out, thereby reducing the risk of